So 15 measles cases in North Carolina in just about a month. You know, we had a single case in all of 2024, 0 cases between 2019 and 2023. This sort of seems like a big deal.
It is a big deal, and it's reflective of what's going on across the nation, where just this year alone, we've had almost 2,500 cases. Like you said, that's pretty unprecedented because you can count on your hand usually how many measles cases we have per year in the U.S. This is a big deal, and it's leading to other countries considering us to be a measles endemic country rather than a country that has eliminated measles, and that can affect travelers as well. So this is a big deal on many different levels.
We know that the majority of those 15 people who tested positive for measles in North Carolina were not vaccinated. But we also know that the majority of people in North Carolina are vaccinated. So to that, what should they take from this news about the measles cases? Like, how are people who are vaccinated impacted by this?
Right. So what we're talking about is the MMR vaccine. So that's the mumps, measles, rubella vaccine, MMR, pretty commonly given to school kids. 2 doses of MMR provides 97% effectiveness in preventing infection. Like, you won't even get sick. You won't even get infected. So that's really remarkable. This is a very catchy virus. Once we start to see numbers of vaccine rates go down, that's when we get vulnerable. And some of our counties in North Carolina have less than the recommended 95% vaccine rates of school children. That's where we start to see outbreaks. If everyone's vaccinated except for the one person who isn't, they get infected. They can't infect anyone else if everyone else is vaccinated. You need a critical mass of people who are unvaccinated or under-vaccinated in order to get an outbreak. That is the spread from one person to another. So we can nip this in the bud if all of us were vaccinated, or if at least 95% of us were vaccinated, just because the virus can't get a foothold in a community where there's high levels of vaccination.
What about the children who are too young to get this vaccine? Are they really the ones who are at most risk here?
They are, and that's the really kind of other sad part of this is, you know, young children under a year of age who are not eligible yet for vaccine, you know, if they get exposed, they could get measles. And that's where we've seen some of these cases in hospitalization in very young babies. So these are bystander children. They didn't have a say in this, and they can't get vaccinated yet. So yes, that's what we're really concerned about. Now, if a child is exposed, a child, let's say, was exposed to someone with measles, there are interventions. There's some exposure prophylaxis we could give with antibodies. But again, it's not a pleasant experience. It's not easy to get, and we'd like to avoid that situation. So again, that's a really sad part of this is, unfortunately, you know, some babies are getting exposed in our country, and some of them have gotten measles.
What about those children who are in between the boosters, that second dose? Are they really at risk here too, or do they have some protection?
They have some protection. So as I said before, 2 doses get you about 97% effectiveness in protecting you against infection with measles. 1 dose gets you about 93%. So for kids who have had 1 dose of the MMR, if they are exposed to the virus, we give them a 2nd dose of MMR.
Really appreciate your insights, and we'll keep in touch with you as I know the story is going to be one that we continue to cover. Dr. Wohl, thank you.
Thank you.